The oviducts are actually curved back, so posterior, the ovaries and oviduct are posterior and lateral to the oviducts. I mean to the uterus.
This is for the
Okay?
standing.
Yeah, so this is a person in anatomical position. So this is not the way we see it, I mean, in the body. What you would be actually visualizing, if we come back to this image here, well, way back here. So notice how it's bent over, and there's the vagina at right angles, and the oviduct and ovaries are posterior and lateral, okay? So just because it's easier to diagram it that way, I don't want you to think that that's the way it is situated in the body. And so when we look at here in this particular diagram, it might be a little difficult to see that it's bent forward, okay? But we draw it upright in a apparently frontal section just to be able to name things. It's a little easier to look at it that way. So, I'm not going to draw all the oviduct structures out here, just the components. So at the top, this rounded, it's like an upside down pear, is the fundus, okay? We have the oviduct coming in here, in part. And then we have the body of the uterus. And then it narrows and tapers a bit like a pear to form this channel, the component of the uterus. So this portion right here is the cervix. So I'm not layering the parts, the wall structures yet, just the parts of the uterus. So the fundus, the body, and the cervix. Okay? So we actually have three structures attached that we'll see in a later image. And if we look at the spaces associated with the uterus, we have the uterine cavity. This is where implantation occurs of the embryo, usually on the posterior wall. And then the narrow channel here is known as the cervical canal. And I'll draw the upper portion of the vagina in a different color. All right, so the opening from the vagina into the cervical canal is known as the external os. Os means opening. So an ostomy is usually an opening, say, of the large intestine where the part of the colon's been removed, and they bring that opening to the surface temporarily or permanently, or a colostomy. And that would be the internal os between the cervical canal and the uterine cavity. Right? So the sperm moving into the uterus would enter the external os first, pass through the cervical canal, and then enter the uterine cavity via the internal os. The fetus, when it's being born, would move from the uterine cavity through the internal os to the cervical canal, and then finally to the vagina through the external os. All right, so here's internal, here's external. So now we talked a bit about the structures of the ovaries. Remember the two ligaments that supported the ovary that we talked about Monday night? That developed from the gubernacula? So the suspensory ligament developed from the upper gubernacula. We had a lecture quiz about that. And then connecting to that would be the structure right here that we find with the ovarian artery and vein. And then portion of the lower gubernaculum forms the round ligament. Okay? The rest of the lower gubernaculum is a ligament of the uterus. Then we have three structures that form from the peritoneum, and we have a uterosacral ligament. So there are 5 ligaments that we associate that support the uterus in that forward position. So if we look at it cut through here, the next diagram, we're going to look at the peritoneal structures first. Okay? So the peritoneum, the uterus is considered to be infraperitoneal. It's found below the peritoneum. But the peritoneum does attach to about 2/3 of it. And so, we'll come back to it in a moment, but it's covering the fundus, drapes over the fundus. And is reflected off of the body of the uterus. And so, where it's draped over here, it forms a double layer. And we have a really old model. I think I showed it to you for the remnant of the mesonephric tubules. These are the remnants of the mesonephric tubules in the female that don't form anything. So this blue plastic layer here is the peritoneum where it's attached to the uterus. And then it's draped over like a sheet hung over a clothesline. It's draped over the oviduct. You can see it's a double layer there. Partially encloses the ovary, all right? And then below that is a double layer that's lateral and posterior to the uterus. So we'll see this term again when we get to the digestive system, but these are forming mesentery. And a mesentery is a double layer of peritoneum. It's going to have loose connective tissue and blood vessels. We have a lot of mesentery associated with the digestive organs, and we do here with the reproductive. So a double layer of peritoneum. All right, so I'm not going to diagram this because it's a little difficult to do so, but you can see it here. So it's attached to the oviduct, and 2 layers are hanging down, again, like a sheet that's thrown over a clothesline. And like you can see in this model here, so that double layer is a mesentery hanging down from the oviduct. There's a double layer that extends out to the ovary and only partially encloses it. If it completely enclosed it, it would keep the oocyte from being released into the oviduct. And then a large component that hangs down here. So the next image I'm going to show you is if we were looking at it this direction, so we're making a cut through the oviduct, a cut through the ovary, and a cut through the rest of the mesentery here. Okay? So here's the oviduct, and here's the ovary. And the uterus is going to be behind the board, because we cut lateral to the uterus. All right? So here's the oviduct. And to match that, I'll put the ovary here. So if we take that layer of peritoneum, it's going to go around the oviduct. That's our clothesline. And then that double layer containing blood vessels and connective tissue is known as a mesentery of the oviduct. And what was another name for the oviduct? Uterine tube, fallopian tube, or excuse me, what was another name for tubal ligation? Salpingectomy. So salpinx is the Latin term for our oviduct. So this is known as the mesentery of the salpinx or mesosalpinx. Okay? So right here, mesosalpinx. Then one portion of that is going to extend out to partially capture the ovary. So this is the mesentery of the ovary, or the meso-ovarium. Then hanging down, this is where our uterus is, behind the board, and it will go back up over the rectum and forward up over the bladder. But this part right here is the mesentery of the uterus. And our root for uterus is metrium. So this is the mesometrium. Now there's a typo, which I thought I corrected years ago, in your lecture notes on the top of page 92. And it says that all of these are the broad ligament. That's incorrect. The mesometrium is also known as the broad ligament. Okay, not everything else, just the mesometrium. It's also known as the broad ligament because it's the largest of all of these. So I'm going to show you another image, a little more three-dimensional in structure. So we'll ignore the round ligament. Here's our oviduct, this piece right here, mesosalpinx. It's only about a centimeter, half a centimeter wide, coming out, wrapping partially around the ovary is the mesoovarium. And then this part hanging down is the mesometrium or broad ligament. Okay? Now let's go back to that upright picture. So mesosalpinx, at right angles to that, which is hard to tell from this image, mesoovarium, mesometrium, or broad ligament. Okay. So those are the three support structures that are attached or associated with the female reproductive pathway that have developed from the peritoneum. Male reproductive pathway only has one structure associated with it that comes from the peritoneum. Do you know which one I'm talking about?
The tunica vaginalis.
Yes, tunica vaginalis. That little capsule of peritoneum that the testis pulls down with it when it moves into through the inguinal canal. So if we look at, this is from a chart that we use at Sac State, blown up a lot. So again, mesosalpinx at right angles, hard to find. We do see it a little bit on our plasticized model, mesoovarium. Okay. So this is Netter's diagram. I think I showed it to you for the ovarian ligament and the suspensory ligament. So again, mesosalpinx right along here, mesoovarium, and all of this is mesometrium. Okay? So now we're ready to talk about two other pairs of ligaments associated with the uterus that are not from the peritoneum. And we have, passing forward, the rest of the gubernaculum, which is the round ligament. So here you can see that we have the ovarian ligament coming in, that's part of the lower gubernaculum, and then it continues, the lower gubernaculum continues as the round ligament. So, what did the lower gubernaculum do in the male?
Pull down the testis.
Pulls the testis down by passing through the inguinal canal and anchoring the testis to the scrotum. So, talking about homology, the round ligament develops from the gubernaculum, the lower gubernaculum of the female, passes through the deep inguinal ring, through the inguinal canal, and anchors into the labia majora, which we'll talk about at the very tip. But let me just fast forward, well, not fast forward, but move to the external genitalia to show you.
Super.
Okay, so here's the labia minora, here's the labia majora, the fatty, fleshy lip. And so inside that is the anchored end of the round ligament. Just like the gubernaculum testis anchors to the inside of the scrotum. Okay? So we have not another ligament, but we have a third structure that we see from the fundus, and that's the ovarian ligament. So when you look kind of at the anterior top of the uterus, you see these three structures. Most anterior is the round ligament, because it keeps the uterus tilted forward. All right. Then we have the oviduct. Then we have the oviduct. And then the most posterior structure, which makes sense when we think about where it is the ovarian ligament, which is going to attach to our ovary. Okay, so it would be on this side as well. I just labeled it. So that's passing posterior and lateral. So round ligament, oviduct, and ovarian ligament. Okay. Now the last of the ligaments, there's actually another one called the cardinal ligament that we're not going to worry about because we never can, they don't make it in our models. But down near the cervix, attached to the posterior lateral area of the uterus, just proximal to the cervix, we have the uterosacral ligament. So round ligament keeps the uterus tilted forward. Uterosacral ligament kind of catches just above the cervix and pulls it posterior. So we have the anterior tilt, but the posterior back, so it keeps it stabilized front and back, and the mesometrium keeps it stabilized laterally. So this is a little difficult to see in some of our models, but you can see it in our plasticized model here. Did I pass this around Monday? Okay, so let me put a key up on the board. All right. 1, 2, 3, 4, 5. So I have the 5 ligaments marked, and you can pick it up and start moving it around after I get the key up there. Okay. So may I erase our definition of mesentery, and I'll just put the key there.
Can I take a picture?
I have my own personal eraser. I never can.
Wait, hold on 1 second, sorry.
Okay, I'm going to leave the uterus up. I'm just going to erase this side.
Thank you.
Anyone else? So A on that plasticized female is the mesosalpinx. Maybe I just better double check and make sure I have the way I remembered from last night.
The what word? The slide. Really?
I don't think they're my friend. I totally missed them.
Okay? So this is a real pelvis that has been embedded with plastic under high pressure. So when you touch it, you're actually touching the plastic. I say that because the rectum, anal canals opened up, and we have plasticized feces too, okay? So yes, that brown stuff is feces, but if you touch it, you're actually touching plastic. Just anterior to that is the vagina. So if you look up in there, you can actually see the cervix. Here's the bladder, and then the uterus is cut, just so if somebody wanted to look inside it, and that's tilting over the bladder, okay?
Cool.
Alrighty, so now while that's passing around with the ligaments, I'm going to leave that diagram of the uterus out there, and I'm going to label the layers of the uterine wall. So what was our root for uterus again? Metrium. Alright, so where the peritoneum is attached to the wall structure of the uterus, we call it the perimetrium. Okay? The uterine wall is made up of smooth muscle, and we have 2 prefixes for muscle. One is sarco, like sarcolemma or sarcoplasmic reticulum. What's the other one? Myofibril, myofilament. So this is known as the myometrium, and it's smooth muscle, and it forms the wall of the entire uterus, not just the fundus. Okay, this is the smooth muscle we were talking about when we talked about the endocrine system. What hormone causes the myometrium to contract? Yes, oxytocin. Okay, and then we have the lining of the uterus, which is simple columnar epithelium. We'll diagram it in just a bit. This is got quite a bit of connective tissue, and that is known as the endometrium. You have heard of endometriosis? Okay, so this is epithelium plus connective tissue. And it's under the control of estrogen and progesterone. So that's going to be lining the uterine cavity. Here's another diagram looking down into the pelvis. I don't know if it's easier to see or not. But again, here's anterior. Here's posterior. Here's the uterus tilted over the bladder. And here's the round ligament passing through the deep inguinal ring. Okay? Here are those epigastric vessels. So it's lateral to that, just like the vas deferens and testicular vessels are. Here's the oviduct, ovarian ligament, ovary, uterosacral ligament. It's a little small to see the mesometrium. So when dissecting a female cadaver, it's really tight down in there. Unfortunately, all the cadavers that I've worked on here, I've had hysterectomy. So they're all taken out. But well, the one female we had the other one that we had cancer, and then we couldn't find anything in there anyway of the abdomen. Okay? Yes. Sorry.
Would you be willing to repeat which hormones were under the control of endometrium?
Estrogen. I'll talk about when I get to a slide of it in just a bit, because we're going to spell it, and then we'll spend a lot of time next week on it. But yeah, I'll mention it again when we get to the endometrial slide. All right, so question 4. The round ligament of the uterus does which of the following or is found? So it keeps the uterus, choose from the answers, A and B, or all the above, or just one of them. So it keeps the uterus tilted forward. It's homologous or equivalent to the gubernaculum testis. Passes through the deep inguinal ring. I just answered that if, again, your short-term memory. You need a quick replay button on your recording.
All of the above.
And it does it. Well, it keeps it tilted. She did it.
And homologous to Custis.
Is it homologous?
It's a goober.
It's definitely a
So
goober.
it's all of
It passes through the ring.
Yeah, there should be.
All right.
So
E is for elephant.
That one a little easier than the parasympathetic and all the nerve pathways.
most definitely.
Oh, man.
Anyone want more time on this side?
I'm not gonna be a neuro nurse, that's for sure.
That all has to do more with.
The 12?
Well, I mean, when you get to
So
that.
when I was little, I was going to, my mother's a nurse, or was before she retired. So before I was 5, I was going to be a nurse. And then by the time I was 5, my parents, for some reason, took us to see a film, community center on the effects of alcohol, and they sectioned the brain of someone who had died. So I was going to be a surgeon, and then I was going to be a neurosurgeon. And then I didn't meet any doctors that I liked, and so, like, I don't even want to go to medicine. It makes people not fun to be around. I just eliminated all that. And then I started back and I became the nurse, but that was for temporary aspects. It was like as my interest increased, and then it was all personality. So I had a friend in graduate school that said, well, you should be the doctor because I couldn't figure out if medical school changed people's personalities or attracted a certain type of personality. I just never could figure it out. Not that all doctors are not fun to be around, so I dated well, I didn't marry him, but I dated one. We're not going to go there.
How'd it go?
She didn't marry
Not
him?
well.
I didn't marry him. I broke up with him to marry my husband, so his name is, it's funny, 30 years later, we still talk about our exes. Anyway. So I dated him off and on for not 10 years, okay? And I broke up with him a day after. I could not figure out why he would act the way he did and still keep asking me out. So it was like, if you want to be with me, then why do you not call me for 3 weeks? And if you don't want to be with me, then why do you even invite me to go camping or whatever? So we had gone to spend the weekend at the beach in North Carolina, and he was such a blankety blank that I didn't talk to him the entire 8-hour trip home. And then I had another 3 hours to travel back to my place where I worked, my apartment. So I called him the next day and I said, why did you act like this? I've known this guy for 10 years, okay? And we didn't date the entire time. We did first 6 months and the last 2 years. And so he said, well, I just know that you would make, he's 40, not ever been married, and an OBGYN doctor, but he doesn't like women, I figured out. Anyway, so he said, you would make the perfect wife. I love walking on the beach with you. I can't think of anybody that would make a better mother, but I can't make myself fall in love with you.
Wow.
And I was like, what? You can't make yourself fall in love with anybody. And he said, have you ever tried?
Oh my
And I
God.
said, no. And he said, well, then you don't know what you're talking about.
Oh.
And just like that, all my questions
Yeah.
about the way he was
Yeah.
acting were answered.
Yeah.
He was trying to force himself to fall in love with me, and I was just like, goodbye. So that's how I did that. How do we get on that? Oh, so he had an older patient in her 70s or 80s whose uterus was turned inside out and coming out of her vagina. Prolapsed uterus. And so he told me he had done a dastardly deed that day. We had these contests of who could stump the other person with vocabulary. So he told me he had done a dastardly deed that day by giving her a hysterectomy. And I said, dastardly? That means cowardly. It's not cowardly to take out her uterus. But anyway, like I said, he didn't like women. So,
Why does that happen if it's inside out?
so those ligaments we're talking about, they get weakened with childbirth. And this image right here, the normal position of the uterus is what we call anteflexion, bend forward. Some women can be born with it in degrees of retroflexion, but that can occur with weakening of the pelvic ligaments. The mesometrium, the uterosacral, the round ligament especially, as it gets stretched out, is going to allow this to move up. So when it's up in this position, it's going to start sliding down into the vagina. So in the pelvic exam, you may only go in a couple of inches and you're going to feel the cervix. All right, and then as the lateral ligaments, the mesometrium gets weakened, that's not going to support this, and it's going to start to dump in like that and just gradually turns inside out and comes out the vagina inside out. Yeah.
Google research it. They have anal prolapse.
Find some awesome pictures online.
Okay, so look at,
See that.
here's a diagram similar to what I showed on the wall, on the board, okay? So myometrium is what kind of muscle again? Smooth. It can develop benign tumors known as fibroids, okay? These can be really small, which is multiple all over the myometrium. They can get as large as a grapefruit. Typically, they try to treat them by changing hormones, but they might have to do surgery, okay? A few years ago, I was giving my lab exam on reproductive system, and unbeknownst to me, one of my students had a huge baseball-sized fibroid tumor that her uterus was trying to expel. She went home and bled and bled and bled. And when she finally went to the emergency room, her hemoglobin was about 2 or 3 when it should be about 12 or 14.
Wow.
So yeah, and then they did surgery. They again tried to save the uterus, but if it's all over, they might end up having to do a hysterectomy. There was a series of malpractice cases against a particular, I don't remember the name of the company, but they had somebody invented that they made a machine called worked like a macerator to go in and remove these fibroids, which are benign. They don't, or they aren't malignant. They don't metastasize. And so it basically, the little nose hair removal things that you
Yeah.
I've never used one. You stick it up your nose and it spins. All right, so they stick it in there and it spins and it just kind of finely grates and chops up these benign tumors. Unfortunately, there were quite a few significant number of misdiagnoses. The tumor they were grading up was not benign but malignant. And what that did was just take those malignant tumor cells and just send them everywhere. And it was, basically did the metastasis for the tumor. And those women, most of those women died. Yeah. And there were a few doctors who knew it, that what had been happening, and still did do a biopsy first and double check the nature of the tumor before they used that macerator on it. So it wasn't really the macerator, what's the word I want? Producer. It was the integrity of the physician who had cleared that. So you always want to double check, but not everybody knows that they need to do that. So that was a kind of a model. Here's an actual image of large and small fibroids. Okay, I'm assuming those are benign, but since the uterus was taken out because of the size, not because of any malignancy. Okay, the peritoneum contributes to the formation of which of the following?
Two, three.
Two, three, four, right? See?
What's the same answer?
The perimetrium is
I forget what the perimetrium is.
the uterus, like
The outer layer?
I'm sorry. You were saying 5 is also part of it because the pair of whatever the first one makes the perimetrium. That's that with the actual uterus together. It's called perimetrium. Like on her diagram. So 5's automatically one. The broadly loop is the perimetrium draping on the uterus. The meso-oviduct is draping over the ovary, and the other one is draping over the oviduct. The wrong ligament is the gubernaculum. So one is not in it. It's all the other.
Mesometrium. Yep.
Remember what meso stood for? Mesentery, and what is the mesentery formed of?